Hello, everyone out there. My name is Tinu Odunuga. I will like to read one or two articles here from NHS website. One of the sites. The first one is under female genital mutilation, known as FGM, and the second one is erectile dysfunction and impotence. So let me quickly read. I'm going to read directly from this web page. So www.nhs.uk. So now, female genital mutilation, FGM, is a procedure where the female genitals are deliberately cut, injured, or changed, but where there's no medical reason for this to be done. It's also known as female circumcision or cutting, and by other terms such as suna, gudnin, halais, tahu, migres, and kitten, among others. FGM is usually carried out on young girls between infancy and the age of 15, most commonly before puberty starts. It is illegal in the UK and is child abuse. It's very painful and can seriously harm the health of women and girls. It can also cause long-term problems with sex, childbirth, and mental health. Help and support is available if you've heard FGM or you're worried that someone may be at risk. This is from nhs.uk website. Now, I'm just going to talk about the side effect, the sad and painful effect, the blatant pain is the long-term, irreversible effect it leaves these women with. They cannot enjoy sex fully. It depends on the stage. I learned from one of the victims recently that there are about 4 or 5 stages, and she said she had the 3rd stage. Some of these girls would be deformed in that area. Pardon me. This is very sensitive, but I have to unfortunately talk about it. They cannot enjoy sex like people who never had theirs cut. They find it difficult during childbirth, like you read, and so on. You can go on the NHS website to get more information. You can speak to your doctor about it if you are a victim. To come on our show to discuss this, you can send us an email at tinoshow, TINOSHOW, tinoshow at tinoshow.com. Under this message, there is our website there for you to contact us if you would like to come on our TV show to discuss this, or if you would like us to discuss your story as an anonymous person. We'll do that for you in confidentiality. We'll discuss your story. Now, for men who are facing erectile dysfunction, I'll read this. There's one of these research I did recently about men who suffer from diabetes or hypertension, or who once had a kind of, I think, stroke, who had stroke. And it's baffled me when I saw the age of 35 and 40. These men are so young. Some of them are between the ages of 30 to 35. And then some of them are 40 up to 70 who are unable to have full sexual to be fully active sexually. Now I'm going to read this. Introduction. Erectile dysfunction, which is ED, also known as impotence, is the inability to get and maintain an erection. Erectile dysfunction is a very common condition, particularly in older men. It is estimated that half of all men between the ages of 40 and 70 will have it to some degree. When to see your GP? See your GP if you have erectile dysfunction for more than a few weeks. They will assess your general state of health because the condition can be the first sign of more serious health conditions such as heart disease. When the heart's blood supply is blocked or interrupted. Why does erectile dysfunction happen? Erectile dysfunction can have a range of causes, both physical and psychological. Physical causes include narrowing of the blood vessels going to the penis, commonly associated with high blood pressure, hypertension, high cholesterol, or diabetes, hormonal problems, surgery or injury. Psychological causes of ED include anxiety, depression, relationship problems. Sometimes erectile dysfunction only occurs in certain situations. For example, you may be able to get an erection during masturbation, or you may find that you sometimes wake up with an erection, but you are unable to get an erection with your sexual partner. If this is the case, it is likely the underlying cause of erectile dysfunction is psychological, stress-related. If you are unable to get an erection under any circumstances, it is likely that the underlying cause is physical. Erectile dysfunction can also be a side effect of certain medicines. Although you may be embarrassed, it's most important to get a diagnosis so that the cause can be identified. Your GP can usually diagnose erectile dysfunction. This will involve answering questions about your symptoms, as well as a physical examination and some simple tests. That was read from nhs.uk website. You've heard some medical terms on female genital mutilation, the effects, and then when the man has erectile dysfunction, which is also known as impotence. You can see that he is almost unable to satisfy his partner. Sometimes it just gets a little bit, the penis gets a little bit erected to penetrate a bit for a few minutes. Sometimes he might not even be able to get a full erection. It depends. But the truth is that even though the man might be embarrassed, you still have to speak to your GP. Forget this embarrassment, because it might be a sign that there's going to be something that needs to be done. I don't want to sound too harsh. Even though I'm going to be truthful, I have to be very cautious. When I'm talking in the public, I am very cautious of my chosen words. Even though those words might be the right one to use, I have to be very sensible, and I have to be very cautious. I have to be very wise. I don't want to step on wrong toes. That is, some people who are very sensitive, some people are psychologically sensitive. So I have to be very calm as well. Now, the reason why I read these two articles, one on female genital mutilation and one on erectile dysfunction, is that I've listened to some women. Some of them are victims of genital mutilation. Some of them are wives. Some of them are partners to men who cannot satisfy them sexually. I've heard of some women who go out of the relationship to get pleasure. Some of them get some toys. Some of them don't. Some of them are not happy. Some of them complain that their men do take it out on them. They blame them for their erectile dysfunction. You've heard medical term. I think the best thing to do is to go to the GP and get more information. My name is Tinu Odunuga. Thank you. Bye-bye.